Okay, looks like we've got most everybody. So we just want to welcome to It's Worth a Shot. This webinar, we'll be talking about eye awareness and then do an introduction to Viven Health interactive training. Can we go to the next slide? And as always with this series, if you guys have been regulars, you do know that we do have internal presenters and external presenters, which we do have 2 external presenters today. So we just want to let you know that the information that they share does not constitute endorsement or recommendation by Mountain Pacific. We just like to give you guys as many options as possible. Next slide, please. We do want to make you aware that January was National Glaucoma Awareness Month. I do realize that we are in the last day of that, so we definitely should have made you aware sooner, but now you know, and there's a link there to some information. And then also February is Age-Related Macular Degeneration Awareness Month. So again, there's a link there to help inform and give you some information. Next slide, please. And as always, we want to thank you for joining us. We also would very much appreciate if you have any topics or ideas for us to cover, to go ahead and chat them into us or put them on the evaluation that Mary will put in the chat. And if you fill that out, we always appreciate that as well. And again, we want to thank you for we want to thank you for joining us every Wednesday. We do have 2 quick polling questions here. So Mary will get those started for us. The first one is, does your facility have an opioid stewardship program? And then if you answer no, if you can let us know, are you interested in starting one? We'll give you a couple seconds to go ahead and fill that out. Seeing we're split about half and half on the first one. All right, let's go ahead and close that there, Mary. Thank you so much for joining or participating in the poll. We do take this information back and figure out how to use it internally. Okay, next slide. So influenza rates have been dropping, which is great. As you can see, our areas, which Alaska, Montana, Wyoming, and Hawaii, we are mostly in the minimal to low. Looks like Wyoming is a little bit higher, but that's okay. You know, it looks like it's coming down, so that's always great. Next slide. And with the decrease in flu, we were actually seeing an increase in COVID in our areas, but overall, there is a decrease in hospitalizations and also in COVID deaths. So that's great to see. But as you can see, Alaska, parts of Montana, parts of Wyoming and parts of Hawaii are all in the substantial increase. So again, we just want to kind of promote the vaccine to help decrease symptoms and severity of COVID is caught. Let's go ahead and go to the next slide. And we did have a question from last week's NHSN presentation, and they wanted to know, where do we complete the attestation? So she let us know that the AOR reporting requirements are with the Centers for Medicare and Medicaid Services, and that the system, that your quality department should have access to that. It does take a, what do you call that? A preferred login. So you have to have a special login to be able to get in there. If you have any further questions, we will put you in contact with her and she can get a little bit more detailed information there for you. Next slide. Okay, we want to start our presentation with Dr. Morse. He is joining us from his practice and I will turn it over to him.
All right, good afternoon, everyone. Thanks for having me here today. I'm a primary care optometrist here in Casper, Wyoming, and I thought what we would do is, since we're right in between the months of January and February, we'll saddle both of these topics with January having been Glaucoma Awareness Month and February being Macular Degeneration Awareness Month. But we'll touch on these 2 eye conditions. They're the most common eye conditions that we tend to see primarily in our aging population. So let's go to the next slide, please. All right, so again, really common age-related conditions. Cataracts, very common, but again, what we're going to talk about today is age-related macular degeneration, also known as AMD, and then the other condition, glaucoma. And if we could go to the next slide, please. Okay, so of these common eye conditions, and I see them all the time in practice, they have very, very common visual symptoms. And you can see from the slide, blurry vision and focusing problems. And these are actually vision changes that are occurring. And, you see the picture of the glasses there on the left side of the slide. And typically when we have blurry vision and vision changes with these conditions, glasses do not help. Patients might think that that's all they need and that that's going to improve their vision, but again, a lot of times with these conditions, they really don't help as much as what we would hope. Loss of contrast sensitivity, again, being able to discriminate different layers and different depths of contrast. And when we have a loss of contrast sensitivity, it makes it difficult for people to see in different illuminations, different environments, and can make navigation really difficult. Delayed light to dark adaptation, and this can be, again, from going from a light brightly lit room to a dark room and having a difficulty letting the eyes adjust to that. But we can also see it be troublesome when we go from dark to light, and loss of depth perception. Typically we'll lose depth perception when we have a significant visual impairment. Again, the way our eyes achieve depth perception is for them to work very well together, with very accurate focus and being balanced between the two eyes. And when there's a loss of vision there, we're understandably going to lose some depth perception. And then glare sensitivity. Again, it's really common to see this with our cataract patients, but we do also have glare sensitivities with macular degeneration and glaucoma. And it's kind of a difficult thing because oftentimes with those conditions, we need more light to try to see better, but too much light can also be a bit of a problem. So next slide, please. Okay, so with macular degeneration, again, we've got an artist rendition of and a visual simulation of what's missing in the vision here. But typically, it's going to be a loss of central vision. It's going to create a distortion or a blurriness in some of the advanced cases of macular degeneration. It's going to be an outright blind spot in the middle part of their vision. And these are blind spots that these patients, they cannot see around it. It's just always there. And I do want to make a distinction on macular degeneration real quickly. Basically, there's two types of age-related macular degeneration. There is the more common form, which is dry macular degeneration, which accounts for about 90% of the cases. And then there is the wet macular degeneration, also called an exudative macular degeneration. That's 10% of all the cases. And the distinction there is that with the more common form, the dry form, it's a slower progression. It generally is less visually devastating, whereas the wet form can have significant impacts over vision, particularly that central vision, and it can happen much, much more quickly. Next slide, please. Okay, and when we talk about glaucoma, I think glaucoma can be equivalent. It's kind of the eyes version of hypertension. And, again, hypertension has oftentimes been called the silent killer because, again, most patients with hypertension, they may not be aware they have it. The same is true with glaucoma. It's a silent loss of vision. Glaucoma in its most common form is called a primary open angle glaucoma. And the vision loss that occurs from it happens very, very slowly over time. It's painless, and the vision loss is occurring. And because we typically have two eyes, they're kind of covering for one another and covering some of the vision loss. And so typically with glaucoma, you'll see it's a loss of peripheral vision. It affects the photoreceptor cells peripherally as it relates to the optic nerve in the back part of our eye. So oftentimes it's a peripheral vision loss. And again, that makes it less aware that it could be happening to us. Now, in advanced stages of glaucoma, in the advanced cases, then not only do we have a loss of peripheral vision, but it then starts to encroach on our central vision as well. And if it's totally left unchecked over a long period of time, actually can steal all of the vision. Next slide, please. So when we talk about these two conditions, let's touch on some treatments first. Many of you might know someone, have family members, friends who have macular degeneration. Now, if they have the wet macular degeneration form, which again is 10% of the cases, typically the standard of care now is to do injections, and these are called intravitreal injections. Typically, it's like a shot in the eye, and these injections are using various drugs. They inject right through the white part of the eye, make their way to the back part of the eye. And typically these injections are carried out in 4 to 6 week intervals, and typically they're administered over several months and even several years, depending on the success of the treatment. And we look at these injections as not necessarily curative, where we're going to return some lost vision, but simply we're hopeful that this type of treatment will prevent, the faster vision loss. In the dry form of the macular degeneration, once again, the 90% of cases, injections are not effective there. And the only thing that we've had available to us for treatment there is the antioxidant supplements. And some of you might have heard of, some of the studies. The biggest one is called the age-related eye disease study, and they've undergone 2 of those. And so the latest one is the age-related eye disease study number 2, or ARIDS 2, and basically it's a formulation of supplements, including some of the antioxidants that can be taken, again, like a multivitamin, to maybe try to slow down progression or maybe even be preventative in some, but not all cases of macular degeneration. And then in regards to glaucoma, basically the treatment for glaucoma is you're going to lower pressure of the fluid inside of your eye. And by lowering that pressure, you're hopeful that you are reducing damage to the nerve fiber layer, which is in the back part of our eyes, again, where the optic nerve is. So it's typically going to involve topical medications as a first line. And then in some cases, in the more advanced cases, there are surgical procedures that can be undertaken there. Next slide, please. Okay, and as far as new treatments kind of on the horizon, again, we talked about the dry macular degeneration being the most common. And in some cases, dry macular degeneration will progress to a severe form of dry macular degeneration where we have pigmentary loss, and also called geographic atrophy. And basically what happens in geographic atrophy is just a total loss of the pigment layer of the retina, which then does not leave any support for the photoreceptor cells. And so it's an out and out blind spot in the central part of the vision. So there are some new medications. As of now, there are 2 medications that have just hit for the public. Again, it's an injection, and it's in hopes of not necessarily curative, but being preventative for, again, progression of the geographic atrophy and further vision loss. In regard to the glaucoma, new medications are coming out, typically topical medications in the form of eye drops. They have a variety of mechanisms of action in the way to lower pressure of the fluid inside of our eyes. Again, with all dry eye drops and all medications in general, there can be side effects. And so new medications come about, trying to lower side effects, increase effectiveness. Dosage forms can vary from medication to medication. And then in regards to glaucoma, we're starting to see selective laser procedures that in some studies have indicated can be used as a first line treatment, maybe before any topical medications. And then as far as advanced glaucoma, there are innovations in shunts and little microvascular drainage procedures as far as treatment there. In the way of prevention, first of all, let's talk about macular degeneration. There are modifiable risk factors for macular degeneration. Now, the big one is smoking. And so if you're a smoker, and you particularly if you have family history of macular degeneration, smoking increases your risk of progression up to 2 times. So smoking is the number one modifiable risk factor. Number two is obesity / cardiovascular health. Again, so improvements in cardiovascular health, cholesterol levels, lipid levels, blood pressure. Again, managing those conditions and managing them well has been shown to be a preventable, modifiable risk factor. We talked a little bit about nutrition. And again, the supplements, particularly for the dry macular degeneration, and then ultraviolet light protection. Again, some studies indicate that long-term ultraviolet light exposure of the retina can increase degeneration of the pigment layer of the retina, and therefore making us more susceptible to macular degeneration changes. In regard to glaucoma, the biggest preventative factor there for glaucoma is basically routine monitoring in the way of routine eye exams. Again, glaucoma is a silent thief of vision, and again, most patients are not aware they have it. So routine eye exams where we can check intraocular pressure, check optic nerve health, check peripheral vision for any of the early subtle losses there is probably one of the best preventative there. And if you already have glaucoma, again, in the way of prevention, one of the best things that we can do there is just being compliant with your treatment. Again, and compliance with glaucoma is sometimes difficult because patients, again, it's painless. They're not necessarily noticing the vision loss that's has occurred with it. So sometimes it's difficult to remember to use your eye drops or to remember to go see the eye doctor routinely for monitoring. And so again, compliance with treatment with glaucoma, very important. And then finally, nutrition. Nutrition for glaucoma prevention. It's not as clear cut as it is with macular degeneration as far as some of the nutritional supplements as far as being helpful. But basically, again, it's along the lines of antioxidants, and it's along the lines of maybe some neuroprotective uh, uh, ways to help the optic nerve. And next slide, please. Okay, so again, we blew through those two conditions. They're the two most common conditions that we see in primary care practice, and again, we blew through those. But hopefully, hopefully you found some of this information to be helpful. And I appreciate being with you here this afternoon. And that ends my presentation, and then we will pass it over to Natasha.
All right. Thank you, Dr. Morse. Hi, everyone. I'm Natasha Dickinson. First of all, thank you so much for having me and Viven Health to introduce our programs to you all. So I am the Director of Clinical Affairs with Viven Health. Next slide, please. So Viven Health is a nurse-founded and nurse-led education company. It was founded by Dr. Tom Ahrens, who is a PhD prepared nurse who's written hundreds and hundreds of journals and books. And he created a company to help people with behavior change. So instead of the typical passive education that individuals receive where you read something or you watch a video, he created a company that specializes in education that promotes behavior change. And that is all based on the premise of interactivity. So we have partnered with Mountain Pacific to provide education for everyone on the topics of sepsis and vaccinations. And currently we are working with different QIOs across the country. Okay, next slide, please. So as I mentioned before, our education is all about interactivity. Everything can be accessed through any type of digital means, whether it be a cell phone, a tablet, or even a computer. All the user has to do is just scan a QR code and they go directly into the program. The programs are meant to be fun, interactive, based on some of the participants that we've had. Many describe it as kind of a game. My background is in nursing. I don't think I mentioned that, but I've been through 1,000,001 different in-services. And let's just be honest, they're not very fun. And let's just be honest, sometimes you just press play and just kind of wait for it to be over. But with our education, it's different because we make the learner do. And that learning by doing is what really gets behavior change. Another important aspect of our education is not only do we help make the information very accessible, we also give reports to leadership so that they can see, who's using the program, how far they've gotten into the program. And that's just part of our programming. And finally, this is a patented education, meaning that our education is so unique that we have a patent on it, which is pretty amazing. But this is just different. We're trying to get away from, the traditional learning and kind of just develop as technology develops, as accessibility develops. People want things right here, right now. And with our education, we're able to provide that. Okay, next slide, please. So as I mentioned before, Mountain Pacific is providing 2 programs to all of the facilities. This will be a program that'll be free to you all. We have a combined vaccine program, which helps educate about RSV, influenza, pneumonia, and COVID. And then also a sepsis education program. This helps educate about how to recognize sepsis, how to identify early signs, and all about prevention. Okay, next slide, please. So if it's okay with you all, I'm going to just do a quick demonstration of the program, just so you can kind of see the concept of our learning and teaching. I'm going to share my screen. All right, and if you all could just tell me when you can see my screen.
We can see.
Okay, perfect. Okay, so if you notice, our education is broke up in small modules. This right here is our combined vaccine program. Each module only takes about 1 to 2 minutes to complete. So the entire program for this would take about 5 to 8 minutes. We try to give people just bite-sized information, but give them information that matters. Time is of the essence for everyone, so we do not want to, take anybody's time up. We want to give them what actually is important to them. So I'm just going to kind of show you and demonstrate how the education works. So we try to keep words down to a limit. Everything is presented in a 4th grade reading level or lower, and it is accessible in any language, well, in most languages. You just have to let us know what language you need, and we will be able to translate. So we do different type of learning styles. This style right here is a drag and drop, and it's all about discovery learning. So for instance, if you would put something in the wrong place, it's not going to let you put it there. It makes the learner go back and put it in the right place. Okay. And this is how behavior is changed and people are able to maintain the behavior. So we just try to present things in fun and interactive ways. We just do things different to try to give the information. So instead of someone just reading this, we take them through scenarios for them to be able to learn it and understand it. Okay. We do offer different vaccination locations, so it's easy for people to know, where they can get vaccines and things like that. And we try to have different type of images that make the learning easy and makes it fun. Okay. So this next module here is just going to kind of show what happens when you're vaccinated and when you're not vaccinated. We try to keep videos down to minimum. If we do have a video, it's usually less than 30 seconds. So here's 2 right here. So as you can see from the ending of that video, we try to make things with an emotional impact. So by seeing the person struggling to breathe, that emotion really does play to a person's behavior decision making. Okay. And as I mentioned, we try to keep the words down to the limit. Okay. And then this is just another scenario in which we're able to teach people what actually happens whenever you get a pneumonia vaccine or any vaccine. If you notice here, we have sleeping germs. So with pneumonia in particular, the germs are already in our body, in the oral pharyngeal area, and certain things will wake those germs up. So for instance, if you're over 65, it's going to kind of wake those germs up and make you more susceptible to the disease. If you have a lung disease, it's going to wake those germs up and make you more susceptible to getting pneumonia. Same with heart disease. It's going to wake those germs up. But if you would get a pneumonia vaccine, it will show you first what it does when those germs are awakened and what it can do. Okay, but if you would get a pneumonia vaccine, for instance, what happens? It helps kill those germs. So things are just presented in a gamified version. And we're not teaching rocket science at all. This is nothing that, it's brand new to anybody. We're just presented in a different way. So you can see different things that would protect you, like hand washing or cleaning surfaces. So I'm going to stop the sharing part because I don't want to take up too much time. And I'll go back to the slides if that's okay. Okay, and then, yep, next slide. Okay, so as mentioned before, Mountain Pacific is providing our programs to all of the Mountain Pacific facilities. It's very, very easy to implement, doesn't take much time at all. You all will be getting a box in the mail, probably within the next week or so, week and a half, and it's going to have everything you need to get started. So step 1, we send the marketing material to your facility. Okay, next slide, please. Step 2, the marketing material is distributed by the nurse leader. Now, this program is designed for residents, for family members, and for staff members. So all you have to do is just distribute the postcards to your audience. This can be done with walking rounds. It can be done in the break room when you're having a conference there. There's no right or wrong way to do it. All we want to do is get the postcard in a learner's hand. Okay, next slide, please. Okay, step 3. Once the user has that postcard or that marketing material, all they have to do is just scan that QR code. If they don't have a cell phone or a tablet, there's also a website link, which they could just type in, which will take them to the program. They're able to register with just their name and their facility name, and they're able to complete the program. as mentioned before, the program just takes minutes to complete. Okay. Next slide, please. Is it working? I froze. Uh-oh. Okay, sorry. I think my internet's getting unstable. Okay, and then step 4, we do send weekly reports to the director of nursing or the administrator every week, and that is emailed to them. Okay, next slide. So I know everyone's wondering, well, how does this work? How do we make it successful? We have been very successful in the various facilities that we've been working with. As mentioned before, the user participation satisfaction has been over 95% with all of our programs, which is amazing. But one tip to help with get going is to provide a time restraint. So for instance, whenever you provide the information to someone, it's important to say, can you please have this completed by the end of March, or have this completed within 60 days. With the vaccines being so timely, because flu and influenza and COVID season is going to be dwindling soon, we want to try to get this program out to get those last minute vaccinations in. Another tip to help with implementation is just get the nursing home leadership on board and excited. Get the corporation on board and excited. You can't do this on your own. You have to have everyone, excited and encouraging people to use it, and to make them feel like it is important, because it is important, not just for the staff, but also for the residents. Our job is to make an impact. Another different way to get people excited is just offer competitions. So what we've been doing is some of the more successful facilities, we might send them a box of cookies or a bag of treats. And that just kind of helps boost your staff morale, and also helps them have a sense of completion and accomplishment with it. And finally, to get your residents involved and family members, you don't have to just have a DON or administrator working on implementation. It can be anyone. So you can even get your activities director. In the past, we did resident in services where all the residents come in the activities room and you pull up a program and you go through the program with the residents. This helps them because tonight they don't have to use, any cell phone. They don't have to worry about reading anything. And it just makes it a fun learning experience for everyone. Okay, next slide, please. Okay, so what's next? So next, we will be hosting webinars with individual nursing leaders if you would like. So if your facility just needs more information or wants extra information or more support, you just let me know and I'll be happy to meet with your nursing leaders. And then we will get those marketing materials sent to you. Like I said, hopefully you'll have that hopefully by the end of next week at the latest. And that will have everything you need to get started. Okay, the next slide, please. And if you have any questions, you all can jot down my email address, jot down my phone number. I am available at any time. Please don't hesitate to ask me anything. And I really do appreciate you for all allowing me to talk with you today. And I am so excited that you all have joined the Viven family, and that you're allowing us to introduce our education platform to all your facilities. Thank you.
Thank you. Thank you, Natasha, Dr. Morse. We really appreciate you guys joining us for the presentation. Can we go to the next slide, Mary? So just curious if there's any questions from the audience before we close out the survey or the presentation. Do we have anybody want to come off mute or put any questions in chat for Dr. Morse or for Natasha? Nope, looks like we're good. Okay, so thank you everybody for joining us. Next week, we will be going over emerging strategies to address the opioid pandemic or epidemic, and also SMART goals. So we hope you can join us next week on February 7th. and we hope to see you then. Again, if you have some time, please fill out the survey or the evaluation that Mary will put in the chat. We do take the results seriously. So please fill that out for us. Thank you very much. And again, thank you to Natasha and Dr. Morse.